Newborn Screening Specimen Collection Kit, a warm, moist, soft cloth or a heel warmer, alcohol-wetted pads or cotton balls, gloves, a heel lancet with a tip depth of 1 mm and a length of no more than 2.5 mm, sterile gauze pads, and aftercare supplies such as Band-Aids or gauze. To get started, make sure you complete all the information on the demographic portion of the collection kit. It's very important that all information is correct and that it can be easily read.
Pushing. Her baby is almost here.
Okay. Beautiful. Excellent. Oh, that's it. Keep it coming. Let's bring that baby underneath that pubic bone. So just a nice gentle push. Good job. Okay. Good job. Just breathe. Hallelujah. Hallelujah.
Seconds.
Guys, kainit yun yung private room, ah? Kailangan nining adlaw dali, honey, ah? Wala pa yun sa, sa ibang channel ng TV? Ibisitin lang. Daw hindi na sulit ang servisyo nila dali sa private room. Yes, po. Yes, po.
How are you, ma'am?
Okay lang naman, Doc.
So, in your newborn screening test po natin si baby, ma'am. So,
Yes, po.
mag-ask po ako ng questions. Kayo po
Yes,
ang mother ni Cardo
Yes, po.
Dalisay. Okay po. Meron po kayong intake na mga gamot?
Wala naman po, Doc.
Okay.
Thank you.
Thank you. Thank you, ma'am. Thank you, sir.
Guys, sana okay na si baby, honey, no? Pangit naman ang showing sa ABCBN. Matutulog na muna ako.
2,000 years later.
Next, position the infant's feet below his or her heart to increase blood flow. Make sure you check the identity of the newborn before you start the collection. Then, warm the heel with a heel warmer. Or you may use a wet cloth that has been soaked in warm water no higher than 41 degrees Celsius for 3 to 5 minutes. We warm the heel because it increases the blood supply to the area. Once you've cleaned your hands and put on gloves, you're ready to start the collection. The heel puncture, also called a heel stick, should be made on the sole of the foot. These are the safe areas for getting the blood specimens. Do not use a previous puncture site. We use the safe areas to reduce the possibility of causing damage to the bone, nerves, or tendons. Before you do a heel stick, clean the heel with an alcohol pad or alcohol-wetted cotton ball and let the skin air dry. We do this because any alcohol left on the skin may dilute the blood specimen. This can cause test results that are not normal. With the heel lancet, stick the heel at a slight angle. Wipe away the first blood drop with a sterile gauze pad. Allow a second, large blood drop to form. We do this because the first blood drop is likely to contain tissue fluids that will dilute the specimen. You can use either side of the filter paper for this procedure, but apply the blood drops to only one side of the paper. Lightly touch a large blood drop to the filter paper. Let the blood soak through the paper. If the first drop of blood doesn't completely fill the circle, quickly express another blood drop and continue to fill the same circle. To help the blood flow, you may apply very gentle, intermittent pressure to the area surrounding the puncture site. However, do not milk the heel or the puncture site. It's important to follow these procedures. Please do not go back to circles partially filled and add more drops of blood. The specimen is not acceptable for testing if it is oversaturated, layered, or clotted. Fill each circle one at a time until all 5 circles are completely filled. We do this because 5 completely filled blood spots gives the state lab enough blood to test for all of the genetic disorders. And if a result comes back abnormal, there will be enough to complete the testing before the result is finalized and reported. When you have finished collecting the blood drops, follow your normal procedures for care of the heel stick site. After taking care of the infant, put the collection kit on a dry, clean, flat, non-absorbent surface. You can use a drying rack for several kits. Let the blood spots dry for a minimum of 3 hours. You are now ready to send the kit to the state lab.